Hi, in this video we'd like to talk about one of Antai Hospital's pioneer specialty way before the treatment of recurrent miscarriage. Before that, we used to be the #1 hospital, the pioneer in the delivery method using Waterbirth. Now, Waterbirth might sound very unfamiliar to a lot of people, but it is considered one of the best and most effective, most painless delivery method that a mother can experience during labor. So by definition, waterbirth means the birth that is happening underwater. Specifically, we mean that the mother will be sitting inside a water tub or a small pool inside a very specific liquid, very similar to the amniotic fluid inside the womb. The temperature is also very specific. It's very specific to the body temperature, very similar. So it's slightly warm as well. Very comfortable water, where the mother's lower body is submerged completely. And then this relaxing environment, over time, she will naturally give birth to a child. And this is one of the most rarely talked about, but most effective delivery method that we here at Antai Hospital always recommend as an option for anyone who's considering delivery. Now, compared to conventional delivery methods, C-section, waterbirth has multiple benefits, especially regarding the pain factor, how it is unrushed, and also minimal birth injury, birth trauma, and also very gentle on the newborn. So the first point is, how is it painless delivery? Because when the mother is submerged in this warm water, her endorphins, serotonins are boosted, elevated, and she's in a state of relaxation and calmness, and this will actually help her with her pain relief. She'll experience less pain. Furthermore, during this submerged in this warm water, very comfortable, she will also have boosted levels of oxytocin, which will make her contractions much more smoother, causing the delivery process to be much more smoother, painless. Furthermore, how there is no birth trauma is that during this process, we don't want to rush anything. And there will be no other surgical or medical intervention. We won't be using any anesthesia, any epidural, or any other intervention. Because all women are capable of giving birth naturally. If we give them time and the environment, they can do this without any other assistance. And this is what waterbirth achieves. And it can avoid any other potential injury, bleeding of the vagina, the cervix, where in many hospitals they will do some incision just to anticipate the baby. Furthermore, we can also avoid any trauma of the child. For example, another very common method used during delivery is vacuum extraction, where it causes some trauma, some bleeding on the baby, the newborn. This all can be avoided using waterbirth. The third one is that it's unrushed. The key distinct benefit of waterbirth is that it's unrushed, and it can take up to 16 hours, up to a maximum of 48 hours. Our doctors and nurses, midwives need to be very patient. We cannot force this waterbirth, unlike conventional natural delivery or C-section, due to limitation of beds, work hours of the doctors. Maybe they want to get off work soon. In many cases, when it's unnecessary, they will just recommend C-section or force the natural delivery by giving labor-inducing medication very similar to oxytocin, just to make it faster. And when they do this, they will cause problems, complications, birth trauma, you name it, all the side effects that we don't want. However, in waterbirth, we simply wait, let it take place naturally while we pay close attention to the mother. We monitor the levels, we monitor the child, but we don't force anything. This is how we can make sure that it's smooth, painless, and that it requires no medication. It is a very beautiful thing to experience. Lastly, it's also very gentle on the baby during the exit via the vagina, because the water is very similar to amniotic fluid. There's not much trauma when the baby exits the vagina, and it's also very active. You can see the baby swimming, it's using the limbs, and opening the eyes. It's a very good transition phase for the child, so it doesn't immediately enter into oxygen breathing using the lungs. It's still connected to the mother with the umbilical cord, and when you are ready, you can actually pick up the child and then introduce air breathing. But during when the child is in the water, he'll be swimming and roaming freely. This is something also that we can provide, because it's very much more easier and gentler on the child. So these are only some of the benefits, few benefits of water birth. Although it is not common, you should always opt for something that is painless and it does not induce any potential injury that can be complication inducing. Antai Hospital is one of the pioneers of water birth, and we always recommend it to our patients, especially those who want to have a beautiful journey, something that is quite memorable and they can also look back in. So if you'd like to find out more information about our water birth service, how we do it at Antai Hospital, and also look at our videos that we provide showing water births for previous patients, you can all find that on our website and also our YouTube channel. Please leave me a comment down below as well.